Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is evaluating a patient with a suspected compression neuropathy of the median nerve. Which of the following findings would help confirm a diagnosis of anterior interosseous nerve syndrome over other median nerve neuropathies? Option 1, inability to perform an OK sign. Option 2, sensory loss in the palm of the hand and lateral fingers. Option 3, AIN deformity. Option 4, positive Tinel sign at the cubital tunnel. Anterior Interosseous Nerve Syndrome, or AIN syndrome, is a rare, purely motor neuropathy caused by compression or injury to the anterior interosseous branch of the median nerve in the forearm. It presents with weakness in specific muscles: the flexor pollicis longus, the flexor digitorum profundus to digits 2 and 3, and the pronator quadratus. Here's the defining characteristic of AIN syndrome that you absolutely must know. Because it is a motor neuropathy only, there are no associated sensory deficits. That information will be helpful when eliminating possible options. This question is also asking something more nuanced than simply identifying AIN syndrome. It's asking which finding would help confirm AIN syndrome over other median nerve neuropathies. That means we need to find the finding that is unique to AIN syndrome and not shared with pronator syndrome, carpal tunnel syndrome, or other median nerve conditions. Let's keep that in mind as we work through the options. Option 1, inability to perform an OK sign. A classic clinical sign of AIN syndrome is the inability to make an OK sign. AIN syndrome results in isolated weakness of the flexor pollicis longus and flexor digitorum profundus to the lateral half, resulting in weakness with thumb and index finger flexion, respectively. Because the patient cannot flex the interphalangeal joints of the thumb and index finger, an attempt to make the OK sign will result in pulp-to-pulp contact instead of tip-to-tip. This is a beautiful clinical sign because it is so specific to AIN syndrome. No other median nerve neuropathy produces this specific pattern of weakness in isolation. Option 2, sensory loss in the palm of the hand and lateral fingers. Sensory loss in the palm of the hand and lateral fingers would more likely be seen with pronator syndrome, since this condition is associated with both motor and sensory deficits. AIN syndrome will result in motor deficits only. Remember our defining characteristic: AIN syndrome is a purely motor neuropathy. The moment you see sensory loss listed as a finding, you can immediately rule out AIN syndrome. Eliminate this one quickly. Option 3, AIN deformity. AIN deformity is characterized by thenar muscle atrophy and an inability to oppose the thumb, resulting in the thumb being aligned in the same plane as the fingers. While this deformity does result from a median nerve injury, it would only occur in conditions where the thenar muscles are affected, such as carpal tunnel syndrome or pronator syndrome. The AIN does not innervate the thenar muscles and therefore would not result in an AIN deformity. This is another sneaky distractor. AIN deformity is indeed a median nerve finding, so students who know their median nerve anatomy might be drawn to it. But the AIN branches off before reaching the thenar muscles, meaning those muscles are not affected in AIN syndrome. AIN deformity tells us the thenar muscles are involved, which points us away from AIN syndrome and toward a more distal or widespread median nerve lesion. Option 4. Positive Tinel's sign at the cubital tunnel. Positive Tinel's sign at the cubital tunnel is characteristic of cubital tunnel syndrome. This condition affects the ulnar nerve, not the median nerve. This option takes us to an entirely different nerve. The cubital tunnel is the home of the ulnar nerve at the elbow. A positive Tinel sign there implicates the ulnar nerve, not the median nerve, and certainly not the anterior interosseous nerve. This option can be eliminated immediately. Wrong nerve, wrong tunnel, wrong diagnosis. When we look for the finding that is both consistent with AIN syndrome and unique to it among median nerve neuropathies, the inability to perform the OK sign stands alone as the defining clinical sign. The correct answer is option 1. Let's explore the all-student data. 65% of students selected option 1, inability to perform an OK sign, the correct response. 15% of students selected option 2, sensory loss in the palm of the hand and lateral fingers. 15% of students selected option 3, ape hand deformity. 5% of students selected option 4, positive Tinel sign at the cubital tunnel. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. This question is a physical therapy examination question, which represents approximately 24% of all exam items. This question is a level 2 question, since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Thanks for joining us on the Score Builders Q&A podcast. See you next week.